Dear listeners, hello! Recently, hot events have occurred in many parts of the world. From public health crises and violent criminal cases in the United States to social unrest in the Middle East, each of these events touches people's hearts. Next, let's sort out the context of these events supported by authoritative information one by one. First, let's focus on a real law enforcement shooting incident in Minneapolis, Minnesota, USA. According to authoritative reports from cable news network CNN and The Washington Post on January 8, as well as the official announcement from the U.S. Department of Homeland Security on January 7, U.S. Immigration and Customs Enforcement ICE personnel shot and killed 37-year-old U.S. citizen Renee Good during an immigration law enforcement operation in the city on January 7 local time. After the incident, it immediately triggered widespread attention and protests locally. And both the governor and mayor publicly condemned the ICE operation. There is a core dispute between the two sides regarding this shooting incident. The U.S. Department of Homeland Security claims that Renee Good tried to hit law enforcement personnel with her car, and the law enforcement officers shot in self-defense. However, Minneapolis Mayor Jacob Frey clearly refuted this, stating that the public video shows no evidence of the vehicle hitting law enforcement personnel, and the so-called self-defense claim lacks factual basis. Minnesota Governor Tim Walz also severely condemned the Trump administration and the Department of Homeland Security, stating that this large-scale ICE law enforcement operation is equivalent to waging war, and at the same time urged the public to protest peacefully. Currently, the follow-up investigation into the incident is still ongoing, and public discussions on law enforcement standards continue to heat up. After talking about this incident, let's turn our attention to the Middle East. The extremist organization ISIS has long been active in the Middle East, including Syria and Iraq, bringing persistent instability to the local situation. This extremist organization has seriously disrupted local social order, threatened the lives and property safety of local people, and posed great hidden dangers to regional and global security through launching terrorist attacks, harming civilians, and destroying infrastructure. Although the joint crackdown by the international community has severely damaged ISIS's forces and made it lose most of its controlled areas, the organization has not been completely eliminated and is still active secretly. The current situation in Syria is inherently complex, with multiple forces intertwining and competing for interests. The continued existence of ISIS has further worsened the local security situation. According to reports from Xinhua News Agency and People's Network on January 11 to 12, the U.S. military launched large-scale air strikes on ISIS targets in Syria on January 10. The U.S. Central Command issued an official statement confirming this incident. This operation is part of the Eagle Eye Strike operation and aims to respond to the previous fatal attack by ISIS on the U.S.-Syria Joint Patrol Force. It should be noted that the overall security situation in the Middle East is currently tense, and the recent protests in Iran have also attracted widespread attention from the international community. According to U.S. media reports on January 10, unconfirmed by the Iranian government, protests have broken out in many parts of Iran, presumably triggered by rising living costs. There are reports of casualties and interruptions to internet services. Iranian people's dissatisfaction with the economic situation has accumulated for a long time. The long-term living pressure has gradually deepened their dissatisfaction, and this protest is the concentrated outbreak of these emotions. Faced with the wave of protests, the Iranian government stated that the protests were secretly instigated by the United States and Israel, and vowed to resolutely stop the protests. Currently, the situation in Iran is still in a state of tense confrontation. The international community is closely monitoring the development of the situation, worrying that further deterioration will trigger a greater humanitarian crisis and regional turmoil. After talking about the tense situation in the Middle East, let's turn our attention back to the United States. According to a report from Global Network on January 12, the protests triggered by the previously widely concerned ICE shooting incident in Minneapolis, Minnesota, continued to ferment. On January 10, tens of thousands of people held a rally in the cold, calling for a fair investigation into the incident and holding the involved law enforcement personnel accountable. On that day, the temperature in Minneapolis dropped below 0 degrees Celsius. Protesters gathered in a park not far from the shooting scene, holding slogans such as "ICE murdered Renee Good" and "Prosecute Agent Jonathan Ross." There were also mothers holding children and elderly people participating in the rally, with grief and anger in their emotions but maintaining a peaceful demonstration. In addition to this ongoing protest, the recent measles outbreak in South Carolina, USA, has also caused deep concern among. According to the official announcement from the South Carolina Department of Health and Environmental Control on January 8, the latest authoritative data as of now, the cumulative number of confirmed measles cases in the state has reached 211, including 45 cases in children under 5 years old, 143 cases in adolescents aged 5 to 17, 196 infected people who have not been vaccinated against measles, and 4 people hospitalized due to severe illness. The epidemic is mainly concentrated in Spartanburg County in northwestern South Carolina. A large number of people in this county have obtained exemptions from vaccination for religious reasons, which has brought great challenges to epidemic prevention and control. From the perspective of the infected group, most are adolescents aged 5 to 17. And most of them have not been vaccinated against measles. Measles is an extremely contagious virus, mainly transmitted through respiratory droplets, and is very easy to spread. The epidemic is mainly concentrated in northwestern South Carolina. According to the investigation by the health department, some cases are related to travel, some are infected through close contact, and the source of infection for some cases is still unclear. Health department staff emphasized that there is clear evidence that community transmission of measles has occurred, which means that the virus has spread independently in the local community and is no longer limited to imported cases, greatly increasing the difficulty of prevention and control. To curb the spread of the epidemic, 144 people have been placed under isolation measures locally, and relevant departments are actively carrying out contact tracing work. As of now, the official has not reported the spread of the epidemic to other states, and the previously rumored information about related cases in Washington state and North Carolina has not been confirmed by authoritative sources. The current flu season in the United States is still ongoing. The superposition of the flu and measles outbreaks has brought great pressure on the public health system, and the workload of medical staff has increased sharply. It is worth noting that federal health officials have recently adjusted the flu vaccine vaccination recommendations, but the U.S. Centers for Disease Control and Prevention (CDC) has not changed its recommendation for measles vaccination. It still recommends the measles, mumps, and rubella MMR combined vaccine, emphasizing that 2 doses of the MMR vaccine can provide the highest level of protection, especially for children. Vaccination is the most effective way to prevent measles infection. Currently, the South Carolina Department of Health is actively taking a series of prevention and control measures, including increasing the publicity of measles vaccination, expanding the scope of vaccination, and strengthening epidemic monitoring. It also calls on the public to raise their vigilance, do a good job in personal protection, avoid traveling to areas with high epidemic incidence, and seek medical attention in a timely manner if symptoms such as fever and rash appear, and take the initiative to report their travel history and contact history. Finally, let's talk about the situation in Venezuela, which has attracted widespread attention from the international community. According to authoritative reports from Global Network and People's Network on January 11 to 12, the United States launched a raid on Caracas, the capital of Venezuela, on January 3, forcibly took control of former Venezuelan leader Nicolas Maduro and his wife, and took them to the United States. On January 5, Maduro and his wife appeared in court for trial at the federal court in New York, and the relevant court proceedings are still ongoing. In response to this incident, Venezuelan interim President Delcy Rodriguez delivered a public speech on January 10, promising to take all necessary measures to rescue Maduro. On the other hand, U.S. President Trump signed an executive order on January 9, declaring a national emergency aimed at fully controlling Venezuela's oil revenue. Currently, the situation in Venezuela is complex and volatile. Many countries in Latin America and the international community are closely monitoring the development of the situation, and generally call on all parties to exercise restraint, resolve differences through dialogue and consultation, and ensure regional peace and stability as well as the basic well-being of the people. The above are the several international hot events we are going to talk about today. Although these events have occurred in different countries and regions, they all have a profound impact on the local situation. How these events will develop in the future. We will continue to pay attention to authoritative information and broadcast it to you. Thank you for your listening, and see you next time.